News 46 is brought to you by Golden Casino Group, where you'll always find great fun, good food, and fantastic entertainment, all at Gold Town, Lakeside, and the Pahrump Nugget. News is also brought to you by J.K. Nelson Law. Call 727-9900 today for your free consultation. If you need a lawyer, you need Nelson. News 46 is also brought to you by Humana, serving the community. Please stop in at 1397 South Loop Road on the corner of Loop and Highway 160.
Tonight on News 46, a local doctor talks about the opioid crisis.
And the Painted Lady Saloon is packing the house with new music. News 46 starts now.
You're watching KPVM News 46 with Zach Reinert and Eunette Gentry. Local coverage from Deanna O'Donnell. News 46, local coverage you can count on.
There's help available for those dealing with addiction. It's Thursday, February 1st. I'm Zach Reinert.
And I'm Eunette Gentry.
Well, opioids cause more than 42,000 deaths annually in the United States, and that figure is increasing. Drug manufacturers, doctors, and pharmacies are trying to limit access to prescription opioids. Dr. Stephen Andracki from Healthcare Partners talks about the crisis and how you can get help if these drugs have taken hold of your life.
Federal government has determined that there are opioid issues, and they're trying to address this. On a state level, there was a Senate, actually Assembly bill that was passed in 2017 that went into effect on January 1st, 2018. That put a whole number of restrictions onto the providers prescribing these medications. None of them are something we can't work around, but they want us to be responsible prescribing and making sure we're not prescribing more medications for patients than what is safe.
So has this been going on for many years, opioid prescriptions, people using opioids, or is this something that we're just hearing about in recent years?
If you look historically, there's a couple factors to consider. One is that when I started practice, it was really unusual to write a lot of pain prescriptions. We use Tylenol with codeine primarily for pain control. Now we have so many strong pain medications that are being used because people say, I have pain, I need to be treated. But so we are writing many more times the amount of pain medication than we were, for instance, 30 years ago. But interesting, if you ask people and you look at the research, there's just as much pain now than there was 30 years ago. So writing more prescription pain medication does not decrease the pain in people in the United States. It's perceived that it helps them, but it does not when we look at this, and there's more overdoses and more people dying. Maybe 130 people every day are dying of an opioid-related overdose. A lot of those are done with illegal drugs, and a lot of reasons for that. They're more accessible, they may be cheaper, they may be cut off from their supply of this. So we do have a problem, and we analyze this over the years. This is becoming more of an issue than it was, for instance, 30 years ago.
So there's restrictions now with the insurance companies, with the pharmacies, with different healthcare providers?
There are restrictions specifically on us writing them, not the amount, not the concentration of them. Nobody's saying what we can and cannot write. We have to make sure that the patient has not been getting prescriptions from other providers, that they notify the patients of the risks associated with taking these medicines, that we give them the antidote. All of these rules that have been put in place by the state of Nevada are reasonable rules. They can be construed as being onerous and just too burdensome for the providers. But it's time that we accept our responsibility for what we've been part of. And the pharmacies are attempting to assume a responsibility for them as well, because there are pharmacists in the past who simply dispense too many medications. So the pharmacists are trying to work on this as well by trying to restrict the amount of prescriptions they give. Everybody has good intentions, although the person who is in the restricted supply of these medications feel that they're being singled out and that they are the ones who are suffering from this, when actually everybody's trying to make this better and to keep patients safer and to prevent overdose deaths.
Nye County is hosting a mobile dental van pilot project stakeholders meeting on February 13th from 10 a.m. until 11:30 a.m. The county is hoping to bring the dental van periodically to our area. The meeting is open to the public and will be held at the Board of County Commission Chambers located at 2100 East Walt Williams Drive. Once again, that meeting is February 13th from 10 a.m. until 11:30 a.m.
Well, the feds may increase their rates beginning in March. Angela Miles reports.
Tapping our news, Fed Chair Janet Yellen wraps up her role this week. On Wednesday, the Federal Open Markets Committee voted to unanimously leave borrowing rates unchanged. President Trump's pick to head the Federal Reserve, Jerome Powell, is next to take over the Federal Reserve. It's anticipated there will be a call for rates to increase at the Fed's next meeting in March. The job market is off to a solid start. ADP reports companies added 234,000 jobs in January. The government's labor report is due out on Friday. Business is booming at Boeing. The jet maker's shares soared to an all-time high during Wednesday's trading session. That stock has doubled in the past year. Boeing posted strong fourth-quarter earnings with a 9% gain in revenue to $25.3 billion. The company expects to turn out a record number of aircraft this year.
Thanks, Angela, and stay tuned to News 46. We're going to tell you about how more women could be running for office.